Interesting for Hannah. Hannah says, thanks for sharing all this. She has a lot of clients who have fibromyalgia, and many have some form of PTSD. Is it your experience that there is some form of physical pain, chronic pain, as part of the PTSD picture?
Oh, well, we're back to my beliefs again. I'm afraid no scientific evidence except for conversations with people like Dr. Pat and other professionals. Yeah. It is my belief that if you have a mental health problem that's unaddressed, there will eventually be a physical problem as a result. And I actually believe it works both ways.
Yes.
So, in other words, there needs to be an holistic approach to solving these issues. Yeah. I'm not saying that fibromyalgia is necessarily related to PTSD directly, but every single person I've come across, including myself, has got some form of physical problem, physiological problem. Not cancer, not at that level, because we've got there beforehand, but that is a suspicion I have, that if it's unaddressed, it will eventually lead to something of that magnitude. So yes, I mean, it's worth considering. I had what they called cysts. I can't remember the sebaceous cysts appear on my head. I had 2 on my head and 1 on my neck. No reason why, they just suddenly appeared. They'd been removed. Of course, they weren't, medically serious things, but uncomfortable and unsightly.
Yes.
My hair went white fairly quickly. There was a story, I didn't actually see this, but I heard of one of the people we ambushed woke up a few hours later and found his head completely gone white, literally in hours. I think if you've got skin problems, digestive problems, those sort of things, you could say there's maybe something else underlying all this. If there's no obvious apparent
and failure
cause.
to address either of them is not
exactly
going to resolve
right.
the problem. Yeah.
So I think if you've got a physiological problem, you should be looking behind it a little bit and asking, is there anything else in your life that
well,
might
and
affect
that, of course, is as you saw from my introduction here, is kind of what I'm hoping that people will take away from this. Someone comes in with a physical problem.
Yes.
When they need to sort of have the cues that will give them the incentive to ask questions about, well, what other stresses are going on in your life. Now, if you are my patient and you've come to me in 1990 with, I don't know, backache or something like that.
Which I had.
Every bootneck's got backache.
Exactly. Not unique.
Yeah. But you've come to me with backache, and I'm doing all my usual tests and examinations and stuff like that. What in you would have been the things I should have noticed that made me think, hang on, there's a bigger psychological component to this perhaps than I thought?
I don't know if there would have been anything you might have recognised, to be honest, because we're very good at hiding things. We're back to that denial thing. Yes. Remember I used the word the mask?
Yeah.
The mask was slipping at the end of my time in the Corps. I was starting to reveal the real personality. I couldn't stop it. I think you've got to ask questions. You've just got to take a little bit of time and watch. The best indicator of all is sleep patterns. Are you sleeping all right? Now, what is right? What is correct sleep? I've always understood it to be 8 hours, unbroken, waking up fresh.
But maybe has it changed?
Some people are different. There are people that have different requirements, and possibly elder people as well need less than younger people. I'm not really sure.
What I meant by that was the change in someone's sleeping patterns. So maybe they only need 7 hours, but what's changed recently?
I think if you're talking about something as serious as PTSD, it will be dramatic. There will be a real change. They're only sleeping for several hours, or they can't get off to sleep at all, or they're having nightmares and all that sort of stuff, and just not proper sleep, basically.
Yeah.
And I suppose the first thing is look for signs of tiredness. And if they're looking generally tired, then it's sleep, it's diet, of course, it's exercise, it's the basic things. If they haven't got that structure in their lives, that simple routine, then the balance is disturbed, and this is where you're going to get the problems.
And I suppose it's rare that we will get our adult patients in with their partner, whoever that might be, but if they are, then sometimes the partner can give some sort of clue that we would otherwise not see.